A lot of times patients come to me and ask me what's the difference between a veneer and just doing a traditional, what we call composite bonding. And the big difference between a veneer is that you are not going to have the kind of staining that is going to recur that you would have with the bonding. The bonding can stain over several years' time. It will take time before it does stain, but it will stain. Veneers will never stain. They are porcelain and they are impermeable. They are not going to absorb any type of staining. So whatever color you select with your doctor as the color that you want your veneer to be is going to stay that way. And the advantage to that is that they're very low maintenance once the procedure is completed. Now, the veneer process is something that we do not do with every patient because we want to make sure that you are getting the results that you want at the end of the treatment. And so there's a process. The initial process involves taking photographs. It involves doing what we call a model so that you can look at your teeth and see what they're going to look like before we've ever done anything permanent to the teeth. And then you're going to wear temporaries that look just like the veneers for a couple of weeks, during which time we can still make modifications to those temporaries in case you decide you want them to be longer, you want them to be shorter, you want them to be a different shape. And then when the final veneers come in, even then, at that point in time, our patients try them on, they have a chance to look at them. Nothing is put on permanently until they're absolutely satisfied with what they're getting. And if there is anything wrong with what they see, if they are in any way not satisfied, they go back to the lab. So the process is time consuming, but because we're really transforming the patient's smile, we want to make sure that they're getting what they want, exactly what they want. And so it can take a little bit of time, but it's completely worth it. I don't think I've ever had a single patient who's ever gone through the veneer process who said to me, I wish I hadn't done this. What they usually say is, I wish I had done this sooner.